Hello and welcome to this video on the connection between obesity and chronic diseases. I am Dr. Sushant Wadhera, Advanced Laparoscopic and Bariatric Surgeon, currently practicing in South Delhi, and I am attached with various hospitals in South Delhi like PSRI, FORTIS and Apollo SPECTRA. So coming to this very interesting topic, today in this video we will be discussing how obesity causes chronic diseases and has affected our lives, and especially our country India, which is now world's third largest in terms of number of obese patients in the world. So what is obesity? So let's start. When you say what is obesity, simple definition of obesity is presence of extra fat or excessive fat which is leading to a bad effect on your health. So it is a complex issue with a variety of causes and associated with a lot of genetic, environmental and behavioral patterns. So what is the connection when we talk what is the connection between obesity and chronic diseases? So we go step by step. First step, which is widely established, and obesity and chronic diseases like diabetes, hypertension, stroke, heart diseases, even PCOD in ladies, fatty liver disease, early osteoarthritis, sleep apnea, all of these chronic diseases have a direct linkage to obesity. So coming to insulin resistance, fatty liver and type 2 diabetes. You all have heard about these terms. So let me clear what is an insulin resistance state in the body. So as a patient becomes more and more obese, the body's cells have secreted more and more insulin because he is becoming diabetic. As long as the diabetes keeps on increasing, the level of insulin keeps on going high. After a while, the body becomes resistant to this insulin. The insulin is unable to take away the glucose from the bloodstream to the muscles and for storage. In fact, the glucose stays behind and the insulin has become ineffective. But the insulin keeps on storing fat, especially in organs like the liver and in the kidney. Now, there is a vexing situation that both the insulin as well as the sugar is rising. So the rise sugar is damaging the kidneys, the heart, the brain, the nerves, and the insulin is worsening this by increasing the deposition of fat in the liver and other organs. Hypertension and heart disease. Now, because of the state of obesity, there is an increased pressure on the heart and on the organs inside the abdomen as well as the chest. Obese patients are more prone for hypertension, more prone for getting stroke and other chronic heart diseases. This all is explained by the level of increased inflammation in the body. Obesity is called a state of chronic inflammation. Here, the patient's immune system, which is a compromised immune system by way of producing more inflammation as compared to a normal human being. A normal route of inflammation protects us against infection and disease. But when it goes haywire, the body cannot control the flow of inflammation and the inflammation is uncontrolled. Obesity is like a chronic inflammation. It's like a chronic state of a fire being put out at a place. So it burns and slowly burns and chars away at all the vital organs. Sleep apnea. Now, the excess weight of obese patients put extra pressure on the breathing muscles, especially around the chest, and their chest walls are very rigid. So what happens is a state of sleep apnea, which is defined as the patient has excessive snoring and with intervals of breath holding spells. So they will snore very heavily and their partners will say that sometimes their breath is stopped for a few seconds. Then they start breathing again. This is a very dangerous condition and can be lethal and can be a cause of sudden death. Joint and backaches. Do you know obesity is linked with early onset of osteoarthritis in younger patients, not like an old person, but in younger patient, and it worsens the outcome. If a person with osteoarthritis is very super obese or morbidly obese, their outcomes after surgery is also very bad, and also leads to increased problems in the back, like more chances of slip disc as well as back sprains. A very important thing which is affecting the entire population today is PCOD. The female population is prone to a disease called polycystic ovarian disease. This is a very important problem occurring in the females today. Especially the females now are having more of abdominal fat. So the ovaries are getting overstimulated. They lead to production of cysts, which is called polycystic ovarian disease. This is again due to the excess fat in the abdominal cavity and due to the inflammation caused by that fat. PCOD and obesity, these go together and make such women infertile. They cannot conceive children despite having had many cycles of IVF. So in conclusion, obesity is a chronic disease and it linked with all the chronic diseases which we know, like diabetes, like hypertension, like sleep apnea. Even many cancers on the body are linked with obesity because of the chronic state of inflammation. If you have any questions or comments, please leave them below and don't forget to subscribe to our channel for more information videos.